It is clear that this generation of young people are not as healthy as their parents.
I practice medicine here in the state of Mississippi, which is the most overweight state in the entire nation. There are a lot of deaths that occur in Mississippi that are, in a lot of cases, unnecessary.
Why is it that African Americans get sicker and die sooner than other groups of people? What can we do to help try to get people into healthier lifestyles? We were clearly deciding that we were going to do something, that it was urgent. We knew we had to do something about it.
We shouldn't live to eat. We need to be about eating to live.
When we looked at the entire situation around health, we think that everybody from the bus drivers to the janitors to everybody in the school system ought to be talking about health. And then we started thinking about who else in the system impacts kids more than anybody. We are convinced that food service workers throughout the Jackson Public School system have the greatest impact on the health of children. They cook for kids in the morning, they cook for them at lunch, for snacks. Food service workers cook for them more than their parents do in many instances. And so consequently, we thought that they should be focused on around their own individual health first, and then that would accrue to the students. If they cook healthier for the students, then the entire student body benefits, and the community does as well.
Y'all ready?
We asked them that if you had a place to exercise, would you do it? And they're like, yes, we will, but we have no place. And so, because we want to remove barriers, we said, we now have a gym, will you come? And they said, absolutely, yes.
Up.
Because they're getting healthier and they eat the food, then clearly there's more attention being paid to the ingredients that go into food on the daily basis. They then decide that they're not going to fry anything else, that they are going to use less salt, and our food service workers are the stars, frankly, in our school system in terms around our health. The next thing we thought about doing after we've kind of gotten the food service workers in place and exercising was, okay, there ought to be a place where these workers can access fresh fruits and vegetables. And so as a result of that, we thought, okay, let's develop a farmer's market. In conjunction with the United States Department of Agriculture, who decided that they wanted to participate in this in conjunction with the Kellogg Foundation. So collectively, we are able to get these two efforts on the ground and going. We're inviting the private sector and other community members to be a participant in this great effort around Jackson called Let's Get Healthy Now Jackson, and that's what we want to be able to do. On one side is the fitness center, on the other side is the farmer's market, so we have food and fitness.
People in this community has never been a member of a health club, never been a member of a gym. They don't have a gym to go to.
Probably the most important thing that happened to us is that we had a visit from our First Lady, Mrs. Obama. Mrs. Obama started Let's Move. The Let's Move initiative is to get kids moving across the country. This is what we're talking about when we say that this improves the health of the community. It has to. Straight from the fields. It doesn't get any better than that. It doesn't get any better. We have to educate our children in a way that they start recognizing that fruits and vegetables, really aren't that bad, and you really ought to eat more of them. That's exactly right. If it rains, you don't have to put any in there. Now we have to make a specific effort to encourage them to work out every day, to do something, to move every day, which is why we also send our fitness trainers into the schools to ensure that that happens 3 days every week.
Here in Mississippi, in some of the schools, they've taken recess and gym out. So that's kind of where our program comes in. We take the place of recess and gym.
We now are able to connect the dots because we see where the community started the process, that went to the schools, that ended up involving the schools, the food service workers, developing the farmer's market and the gym, and so you've come full circle.
The thing that caught my eyes was the fact that this seemed to have been a social entrepreneur venture. It was not just doing good for the community, but it was doing an economic benefit as well as a social benefit. The fact that she was bringing in fresh vegetables, she was buying them from farmers, the fact that she was feeding people who needed to be fed, the fact that she was making them healthier, to me was impressive.
The Roadmap Project has really turned into an event. It's turned into a mission, not just in statement only, but in our work. It has changed the lives of so many people in our community. This project will be in this community for many years to come.
But we will deliver them free of charge. Yeah, awesome idea.
We want to be an incubator for other groups. We think that there are so many opportunities for other groups to emulate what we're doing, to replicate it on a large-scale basis, and we want the country to see that, because it is not rocket science. It simply takes a lot of hard work and a willingness and an interest in getting your community healthy and getting a better quality of life.
The bottom line is, if you can help people lose weight, you can help them become healthier, and they can live longer and healthier lives. So you are just successful. Hey.
We are helping people to live longer, we're helping people to live healthier, and we're helping people to pass that health on to their children. And so in doing that, that should improve the quality of life for our community as we go forward, and particularly for young people.
Alrighty then. And do you know?
And I guess it's the story of trying to make sure that our city gets back on track, to make sure that the people in our city have the kind of services that they need and deserve and that they require. And we're just so happy to support this kind of effort.
We are so proud of this, just to be able to see where we started and to start thinking about kind of gathering people, 2 or 3 people in, to now where we are, where we're seeing a major impact. It's just tremendous, and we look forward to a continuation.
Let's see. Oh, that one's big. How about we get this one here? Oh, okay. Well, let's.
This is a great thing for anybody who's interested in participating in activities in the communities. Private sector companies, I know, will jump on the bandwagon because the advantages reach across the entire communities. We see the opportunities to provide cooking lessons for young women who don't know how to cook a vegetable but want to. And so I know that our private sector friends can help bring that together. We have a community garden where we're taking kids outside to show them a real tomato, and then we're bringing them in the market to show them that it didn't start on the table, it actually started out in the garden where you just picked a fresh tomato. That's the transition that we want young people to make, to know where good food comes from.